The human immunodeficiency virus was discovered in 1983. In 1983, independently in 2 independent laboratories. One laboratory was in France and was led by Luc Montagnier. The second laboratory was the Cancer Institute in the USA, headed by Robert Gallo. It is from this time that we can begin to count the HIV infection which appeared in the world. HIV infection was first registered in it was noticed among homosexual men that they were developing atypical pneumocystis pneumonia, which often led to fatal outcomes. HIV infection is transmitted through 3 routes, which are currently recognized and have long been proven. The first route of transmission is through blood, meaning this is a transmission route where, for example, injection drug users can become infected by sharing a single syringe. This is also a route of transmission where one can, for instance, get infected in tattoo parlors. So that's one way the infection can be transmitted. The second, the transmission route that is now more prevalent, is sexual transmission. And the third route is from a pregnant mother to her fetus. The symptoms of HIV infection can appear in different ways. Every person is unique. For some patients, it can take 2-3 years, while for others, it may take 5-7 years. It depends on how strong each patient's immune system is. In order to determine HIV infection, it is necessary to take an HIV test. An HIV test is done, that is, an HIV test is now done no earlier than 3 months after the patient suspect they may be infected. That is either after unprotected sexual contact or after any procedures related to what I mentioned before, such as getting a tattoo. Various types, that is procedures involving blood. It is recommended to take an HIV test no earlier than 90 days after exposure. Only then can antibodies first be detected thanks to the test systems. Is it possible to raise the question of curing HIV? No, unfortunately, HIV infection cannot be cured because there are no medications to cure HIV infection. There are medications that block the spread of HIV infection in the blood. In other words, scientists around the world are still working on finally creating either a medication or a vaccine against HIV infection. Therefore, at this stage, HIV infection is a disease that becomes chronic. That is, well, it is possible to maintain the body at a certain level thanks to specific antiretroviral drugs.